Welcome to the show where we focus on African leadership and development. It's always a pleasure to have you with us. This week we focus on maternal health care, and we are coming to you from Davos in Switzerland, where we host a panel including Bill Gates, Dr. Jim Kim, and Kenneth Frazier. We get your views on the issues, and as always, we also have Africa's top 10. You're watching the Africa Leadership Dialogues. I'm Julie Gishuru. Mother and child health care, a key issue that is now taking center stage across many economies, and Africa is not being left behind. The World Bank hopes to prevent an estimated 38 million maternal deaths, 101 million child deaths, and 21 million stillbirths by 2030. This week on the show, we delve into the impact investment into maternal and child health. I'm joined by Bill Gates, co-chair and trustee of the Bill and Melinda Gates Foundation, Kenneth Frazier, Chairman and Chief Executive Officer, MSD, and Dr. Yong Kim, President of the World Bank Group. This show was shot during an interactive session with the panel and other stakeholders in Davos, Switzerland during the World Economic Forum. Let's get straight to the panel.
President Kim, in terms of the World Bank and its participation in the GFF, it was created to help countries improve the health of women and children, but how does it represent a different model? And what should we all be doing to be part of the change?
Well, Julie, thanks you. Thanks very much. You know, Julie, the argument and the rationale behind investing in health and education and what some call human capital is so clear. It's just so clear. And there's I think when Larry Summers did the Lancet report, I heard him speak about it once, and he said that in fact, if you're in a developing country and you don't invest in health, it's because you can't count. So, in his usually diplomatic way, Larry made it really, really clear, and I'm so glad he says it that way because it's true. The numbers are just overwhelming, but the problem is that there's a huge shortfall, 33 billion in shortfall, and it's very difficult from our perspective to get countries, when they look at their overall allotment of financing, even concessional financing that comes at very good terms, but that you still have to pay back. They're not choosing to spend it on health and education. Now, you know, we have to change that in a much broader way. But with the GFF, we're really closing the gap, and now countries are really stepping forward. We have 16 countries that now are engaged in getting programs started. And you know, I think over time, this is going to allow us to have a much larger impact. We are able to leverage 4 to 5 to 1. So for every dollar that we receive, and mostly it's been, you know, I see Bill and Borge here, the dollars have been leveraged, I think, very effectively. The programs are going to go forward. But what it reflects is partly a problem. We really have a problem right now in terms of helping countries to understand what it is that they should invest in. So one of the things that I've been doing this past week is that we have got to maximize resources for development. So for example, we spent quite a few sessions with investors and talked to them about how there are so many projects in developing countries that could be funded with private sector money. And so we need to be very disciplined and say if something can be funded with private sector money, airports are classic, ports, even toll roads are being built with private sector money. And generally speaking, even though there's so much money that's earning almost no return, $12 trillion or so in that area in negative interest rate bonds. So investors are paying people to hold their money to the tune of $12 trillion. We can crowd that in and then start paying for those things that countries are now taking sovereign loans for. I think what that will do is open up that space. So we hope it'll open up the space. And then we're going to make a very strong case that you've got to invest in the health, especially of mothers and children. This is a huge start. It's going to get people starting to think much, much more about the importance of investing in the health of women and children. And I think over time, it will be the key to countries being able to compete. I mean, what we're talking about here is the fourth industrial revolution. And what we're seeing is that the lack of investment in children, and you can see it in stunting levels, poor educational outcomes, is actually setting up countries for, I fear, instability.
Chairman and CEO Ken Frazier, why have you stepped up? What is the role MSD is playing here, and what's your message for other corporates?
You know, as a company that's committed to health, we see the fight against preventable maternal deaths as something that's core to what we do as a company. Every 2 minutes, as you know, around the world, a woman dies unnecessarily from complications of pregnancy. And we have an opportunity to do something. And through MSD for Mothers, our 10-year, $500 million commitment to this area, we've been able to provide thus far, starting from a standing start, 6 million women now have access to contraceptives and quality maternal care. So what does that mean, for example? In 2 countries, Zambia and Uganda, in less than 2 years, we've been able, in the affected regions, to reduce maternal mortality by 50%. That's a lot of unnecessary deaths prevented. In Senegal, with respect to contraceptives, in less than a year, we've been able to take stockouts of contraceptives from 80% down to nearly 0. So these are problems that are difficult. As you said, when a woman dies unnecessarily, the impact on her community, on her family is devastating. But the sad thing about this is these are things that can be actually prevented with the right kind of intervention. And the key to intervention, of course, is partnership. And we're just pleased to have an opportunity to partner with Bill and Melinda Gates Foundation, with the World Bank and others, so that we can leverage our respective skills to do something about this horrible tragedy.
Thank you, Ken. You know, so much has been achieved. As a result of the Millennium Development Goals, we have moved forward, but there's still so much to be done. Bill, as I come to you, how do we ensure that we are being more innovative in the way that we are effecting transformation? How can we have innovative models of finance? What do you suggest?
Well, financing primary health care and these interventions that make such a difference, it's a huge problem. Here at Davos, Gavi was created, and so there's a piece of that in terms of getting low-cost vaccines out to kids that actually the world has done a good job. But when you look at the other pieces, the primary health care funding, the high-quality supply chains that need to be integrated, we fall way short. And, you know, it's a shame that it's purely an economic thing. So every new donation, every new idea that comes along that can help fill the gap there, we applaud. We do a lot with Merck MSD. You know, and this, to really win, you have to have great new tools, you know, like the HPV vaccine and a great delivery system. And both of those things are very hard to do. GFF, which we're a partner in, along with Canada and Norway and hopefully many others, now Merck, is encouraging, as Jim said, countries to prioritize health financing. There's been a number of countries that have combined their IDA eligibility with the GFF money and come up with finance aggressive plans that are very measurable in terms of infant lives saved and mother's lives saved, nutrition, reproductive health, all the key things people have talked about here. GFS prioritizes those things and helps them plan the right way to do it. So we need more. There is progress. Maternal deaths, you know, did come down, not as much as was hoped. It's a hard one because in some cases you have to get women to a facility, and having a well-run, well-staffed facility is still out of reach, particularly for the rural population in a lot of the developing countries.
Stay with the Africa Leadership Dialogues.
I mean, we have seen remarkable work being done around midwives as well in communities, ensuring that they do have the skills to do what needs to be done on the ground, but access to clinics and healthcare facilities absolutely critical. Change is happening. Progress is being effected. But Bill, let me come back to you and just ask the question. When we look at the SDGs and the challenge that we have set for ourselves, can we really work together and step up, or are we frankly being a little bit too ambitious?
Well, the SDGs, some of them are going to be hard to reach. For us, the core SDGs are really the continuation of the MDGs. And the primary role of health and nutrition really came through the need to focus on women. And one thing the SDGs do is they uncover best practices. There are countries like a Sri Lanka or Rwanda that, relative to their wealth, both because they prioritize health and they execute well, they achieve amazing results that are equivalent to countries that are 4 or 5 times as rich as they are. And so the SDG process, although we sometimes don't meet the ambitious goal, the kind of comparison that goes on, where we find the positive outliers, unfortunately we find also some negative outliers where the primary health care or vaccine delivery system is completely broken down. Partly it can be supply chain, it can be cold chain, it can be the financing gets confused, so the goods aren't ordered in time to get them out there. The SDG frames this work and allows all of us to go to country leaders and say, hey, your country is behind on these things. We wish the democratic process would always prioritize these things. People would run on, maternal lives saved, but sometimes
Sadly,
it takes outside voices to come in and, talk about what needs to be done. So the SDG framework, brings us all together to measure things in a common way.
Okay, so it is playing a key role in giving us direction and focus moving forward, is what you're saying. Dr. Kim, if the GFF had greater finances, what could it achieve in this space?
To sort of pick up on where Bill left off, the SDGs are just stunning. I mean, it was described to me as the absolute perfect UN process, meaning that everyone contributed. And at one point, I had suggested literally typographical corrections, and David Nabarro, who's in the audience, remembers these discussions. And I said, this is just a typo. You can't eradicate tuberculosis unless you kill all the people who are living with the bug. And they said, no, you can't change that word. and I said, what do you mean? What do you mean? I said, if we change one word, then the whole thing gets renegotiated. Mm-hmm. Because every word of it was negotiated by every single member state, and you change one word, everything goes out the window. Mm-hmm. So it's this incredible document, and I think it actually reflects the reality of today. Meaning, as I go around the world, one of the biggest changes happened were smartphones, and people are aware now of how other people live, what the world is like. And so you now have 7 billion people in the world with aspirations of living sort of a more or less middle-class lifestyle. Maybe not everybody, but a huge number. And so the SDGs actually reflect that. And so in response, what we turned around and we said, oh my God, then we have to think completely differently about financing. And so we wrote this document called Billions to Trillions. And billions to trillions means you take every single available dollar and stretch it as much as possible to cover as many people as possible. So in this particular case, what we hope that the Gates Foundation and Canada and Norway and now the Merck, I'm always knowing you guys as Merck, sorry. Merck.
We don't mind. There are others who do.
Sorry. Ken, when Ken and I were speaking, Ken's mentor was Roy Vagelos, the great man who donated Mectizan, and we had great admiration for them. So anyway, the donors, what we're hoping is that you could give that money as a grant, or you could give it to the GFF and multiply it 4 or 5 times. Mm-hmm. And then and because now again, because it reaches the level of concessionality that now governments are ready to move, that balance is what makes this so important. Now, if you they are taking on indebtedness, but the terms are so generous that it's definitely not going to affect their overall space to take loans, and it's the right thing to do. And so, what we hope is that this is where we go. That every single donor starts asking the question: now, wait a minute. If I can amplify my impact 4 or 5 times, and you have the World Bank and the IMF and others watching very carefully to make sure that the debt to GDP ratio doesn't go up too high, what a great idea. Why would we not do that? Why would we not make a donation that can be stretched like that? And, I'm going to be struck down for saying this, but, we're actually having discussions with the Global Fund right now, the Global Fund to Fight HIV and Malaria, because, for example, the Global Fund is giving grant money to Indonesia and India, and Indonesians and Indians are asking us, well, why don't we leverage this? And if we multiply it 4 times, we could actually build systems that would last instead of just using the money to buy drugs. Now, that hasn't been done yet. I see my buddy Asi, who was one of the originators or the founders of the Global Fund, but I think that when you have 7 billion people with such high aspirations, you've just got to be as creative as you can possibly be to stretch the resources. And so, there's got to be win-wins. So for the private sector, what we're saying is, look, you're paying these people to hold your money. Why don't you work with us and invest in a port or a road or something in a developing country that will actually give you a return over 10 to 15 years? Their response is, yeah, but it's too risky. And we asked them, well, do you understand the differential risks in each African country? And they said, no, it's just all risky. Right? So what we're doing now is we're going to do everything we can to use our capital. Instead of just giving the money for the loan, we're going to use it to help de-risk entire countries, better policies, even going to the point of putting in risk capital. Capital, in other words, first loss capital is if the project goes apart, we'll take some chunk of the loss, and then the others can actually have a better chance of recovering their money. Now we're seeing insurance companies and even pension funds that are so conservative beginning to talk to us about that. And the reason I mentioned that is because that's going to be the key to achieving what we want to achieve in the area of health. Because then the countries will say, oh, I see. So we don't have to provide sovereign guarantees for that stuff. Mm-hmm. Then we can really focus on the human capital investments. That's the vision that we hope to see. And for all the people in the audience who are thinking about this, why would you not take the money that you're using and multiply it 4 to 5 times to have a much larger impact?
So why would you not do it? That's the question. And again, it's the right thing to do, which is absolutely critical. Ken, the buzzword around public-private partnerships, everyone's talking about this, but the bottom line for MSD, why engage and what message would you have? Because we want to see other private sector players get on board. What message do you have for them?
So first of all, doing the GFF is a natural fit because they are targeting the countries of greatest need and working with the governments that are trying to get things done on the ground. So let me tell you why we think this is so important. We're very proud of our history as a company. Mm-hmm. Our core skill set is developing medicines and vaccines. And we've been able to have huge impact over 125 years, recently developing an Ebola vaccine, for example, something that we're very proud of. But just developing those medicines in isolation, we have found, doesn't get them to the people that we need. Mm-hmm. So we have to imagine these health problems, as Bill said earlier, very broadly. We have to think about how we're going to provide primary care health support. We have to work with different people who have very different skill sets. We bring our own skill sets to the table. So, for example, in this area, we're running a 30,000-person clinical trial trying to develop a heat-stable version of carbetocin. That's sort of our sweet spot. But at the end of the day, if we're really going to have the impact that we want to have on these women and these children, it's not enough to be a company that develops vaccines and medicines. We have to work with others in the financing area, in the health delivery area, to ensure that, again, that we reimagine solutions in the broadest way and target those solutions to a way that actually has the greatest impact. And that's why we are so pleased to have these partners, because we know that we can't do it alone.
Stay with the Africa Leadership Dialogues.
Such passion around such a critical issue. Now, let's get straight to your views on the issues.
This week, we asked you, what measures should policymakers take to reduce maternal mortality in Africa? Gilbert Kilunda says, maternal healthcare systems must be strengthened and communities mobilized and educated to improve deliveries in birth clinics.
My name is Robert Choge, watching ALD from Nandi County. Policymakers should give incentive to health providers to do their job effectively. Thank you.
To join our conversation, go to our G+ page, Africa Leadership Dialogues, on Facebook, Africa Leadership Dialogues, on Twitter, @AfricaLD, and on WhatsApp, send your video comments to +254 715 816 033.
And now time for Africa's Top 10.
On Africa's Top 10 this week, we feature the most improved African countries in combating maternal mortality. The aim of the research was to determine the most improved countries from 1990, when the study was initially done, in comparison to the latest study done in 2016 in terms of percentage. This is according to the World Bank. Starting us off at number 10 is Somalia. Located in the Horn of Africa, Somalia managed to reduce maternal mortality by 39.5%. Coming in at number 9 is Chad. The landlocked country in Central Africa recorded a reduction of 40.9% in maternal mortality. Positioned at number 8 is Mali. The 8th largest country in Africa managed to lessen the maternal mortality rate by 41.8%. Taking the number 7th spot is South Sudan. The landlocked country in East Central Africa reduced the maternal mortality rate by 54.3%. Slotted in at number 6 is Tanzania. Located in East Africa within the Great Lakes region, Tanzania recorded a reduction of 60% in maternal mortality. At number 5 is Mozambique. Endowed by rich and extensive natural resources, Mozambique managed to reduce the maternal mortality rate by 64.8%. Eritrea takes the number 4 slot. Another country located in the Horn of Africa, Eritrea recorded a reduction of 68.5% in maternal mortality. Anchored in at number 3 is Ethiopia. As the most populous landlocked country in the world, Ethiopia managed to reduce the maternal mortality rate by 71.7%. Coming in at number 2 is Equatorial Guinea. As the only sovereign state in which Spanish is an official language, Equatorial Guinea managed to lessen the maternal mortality rate by 73.8%. At number 1 this week is Rwanda. Commonly referred to as the land of 1,000 hills, Rwanda recorded a reduction of 77.6% in maternal mortality. And that's Africa's Top 10 this week.
As always, we end with words of African wisdom. Our proverb this week reads, "You cannot hear a baby cry in the mother's womb." A problem doesn't cease to exist because we do not make it center stage. For far too long, mother and child health has been set aside. It has not been a priority, and yet this is where life begins. How do we start to transform that? These conversations, these partnerships are the start of the difference. Blessings to you and blessings to Africa.